Hi everyone. This video we're going to talk about health advocacy. Let's start. So, what is health advocacy? So, health advocacy is the activities relating to ensuring access to care, navigating the system, mobilizing resources, addressing health inequities, influencing health policy, and creating system change, are known as health advocacy. So, as a healthcare professional, it is one of the requirements to be a health advocate. So, to promote health in our communities, cities, countries, and the entire world. So, health advocacy is basically just promoting health at an individual as well as a community level. Okay, so as a health advocate, one should identify health needs and consider culture, identify opportunities for health promotion and disease prevention, as well as to advocate for patients or groups with particular needs. Okay, so advocacy in action is just this list here. It is pretty straightforward. You can pause and read through it quickly. Also, let's look at some case scenarios. So, you are a GP working in a hospital in a cardiology clinic. You saw a 50-year-old patient for his follow up visit 1 month after he suffered from a heart attack. He has no current complaints. On questioning, you found out that he's still smoking 25 cigarettes a day, as he has for the past 20 years, and can't stop. What would you advocate for him? Okay, so at an individual level, it will be health promotion. So you'll discuss the risks of tobacco use, especially given his medical history. You will support the patient to overcome the addiction through counseling, nicotine replacement therapy, etc. So you'll try and promote his health by helping him to get over his tobacco addiction. And at a community level, you'll initiate or support relevant programs for the decrease in tobacco use. And you'll join health professional organizations taking leadership at national level in promoting tobacco control, such as the WHO Framework Convention on Tobacco Control. Okay, so in case 2, you are a medical officer in the clinic. One of your pregnant patients relies on public transport to come to her appointment. She has missed a few appointments and complains that the hospital bus is supposed to arrive at her clinic every 30 minutes, but it's hardly on schedule. How would you advocate to her? So, on an individual level, you'll educate the patient on the importance of adhering to her appointments. You'll also ask for inflammation pamphlets. And at the community level, you'll have a meeting with the hospital manager, discuss the hospital's bus schedule, advocate for more frequent pickups in more busy times. You'll arrange health education talks in the waiting area. Train the local community caregivers to provide health education in the community and things like that. So case 3, you are an intern in Rahima Musa Hospital. On post-intake ward round, a patient informs you that they did not receive any medication since being admitted the night before. He had been admitted for a suspected pneumonia and prescribed antibiotics and a few other things. How could you advocate to him or for him? So at the individual level, you advise the patient on the importance of talking to staff immediately if there are any issues. And to assure the patient that you will help him, you also speak to the staff on duty immediately to find out what's the problem. If no response or pattern reoccurrence, one can contact the head of a department to assist. You can talk to the faculty manager, including the route of complaints, etc. So that's what you can do on a community level. And then also social media is probably the most potent way to be a good health advocate. And the easiest way is to retweet a tweet from a credible source, and in this way, other people can retweet in this way that the correct information is spread by the media, or spread through social media. Um, yeah, and this is basically health advocacy. Health advocacy is just the promotion of health on an individual as well as on a community level. Thank you for listening to this video. Like and subscribe. Cheers.